I'm Kirsten, and I'm here to see Dr. Russ today. I've been seeing Dr. Russ for about 2.5 years. I started seeing him in December of 2020 and was referred to him by my naturopath, my primary care physician, after experiencing some severe pain down my arm that at first I didn't know what it was. So the pain actually, the numbness and the tingling down my arms started probably about 3 years ago. I'm really active, so working out every day, biking, and I snowboard in the winter, and skiing season had just started. Had been out with my family a few times, and I think the day before I woke up with excruciating pain. I had taken like a few minor falls probably on my snowboard, but nothing like crazy stuff that's just kind of normal and expected when you're out on the mountain. The next morning I woke up and pretty much couldn't use my right arm. My two fingers were completely numb. I had pain shooting down my arm. I had pain in my scap and in my shoulder, and just really had no idea what it was. So went to urgent care a few times. They couldn't help me there. Nothing they gave me helped the pain. Ended up talking to my primary care physician and was able to get some pain relief, which allowed me to sleep. This was right before the holidays, and it was really bad timing, obviously. But luckily, right about that time, I was able to get a phone appointment. She recommended me to Dr. Russ, was able to get a phone appointment. And again, this is the height of the pandemic too, so a lot of it is all being done virtually. But in talking with him, he was so helpful in helping me understand what was going on. And at that point, I had gotten an MRI, and he was able to look at that and start to explain what was happening with my bulge disc in C6, C7, and kind of why it was that I was having so much pain and all of these symptoms. This referred pain, the burning sensation in my scap. And when I was able to finally meet with him and kind of go over sort of a care plan in addition to seeing a lot of other healthcare practitioners, one thing he just really stressed was rest. And I thought that was so helpful to hear, that in order to kind of get through this phase, I needed to allow my body to just relax, calm down, reduce the inflammation in the area, and rest was a great way to do that. In addition to, he recommended some supplements. I was doing acupuncture 3 times a week. I was doing PT. I was seeing neurosurgeons to see if I was a candidate for surgery or not. I was really hoping not. But also just really wondering, like, what did this mean for my life going forward? And having been really active, having been, snowboarding and biking and climbing and yoga and hiking and backpacking and swimming, like, I love doing all of these things. And all of a sudden I'm on the couch on medical leave, on an opioid to manage my pain, on gabapentin to manage my nerve pain, and wondering, like, what does my future look like? So kind of hit some depths of depression there for a little while. And Dr. Russ was just so great in talking me through all of the stages of healing, and always reminded me that, like, surgery might still be an option, but we had to kind of get through a few phases of healing before we would really know and before we could assess that. So thankful for his guidance, because that's not what the surgeons like to talk about when you go and get a surgery consult. They want to get you scheduled for surgery right away. And luckily, with his support and with some other practitioners' support, I was able to get off my meds. I was able to get back to work. And one thing that everybody, and especially Dr. Russ, really encouraged was, like, the one thing you can do every day is walk. And if you can get out and walk every day, that will be so good for your body and for healing. And so at first, I was in so much pain I could barely walk around the block, and my arm was just kind of hanging at my side, or I'd have to hold it because it was so painful. And within a few months, I was back up to doing 1 mile or 2 miles, 3 miles. And once I got back to work, I set a goal for myself to do a 30-mile section of trail in Forest Park here in Portland, Oregon. And within 6 months of my MRI, I completed a 30-mile section of trail pain-free, which to me was just sort of phenomenal that I actually got back there and got back there so quickly. And then I was like, okay, I need another goal. This isn't enough. I want to keep going. And I still hadn't been totally cleared to go back to all of my activities yet. So I knew that walking was going to be really important to maintain. So I got back into hiking, started doing some light backpacking, and in the summer of 2022, after kind of getting back to other activities and feeling pain-free for quite a while, I backpacked the state of Washington on the Pacific Crest Trail, and that was 500 miles. I'm so happy I'm back to like being active. I would say like I still have a little bit of numbness every once in a while, or if I push something too much. At one point last spring, I felt a little bit of tingling again in my arm. So it's not that the bulge has gone away, it's still there, but I think that rest and the PT and the things I did and the things that Dr. Russ advised really helped me get to a place where I can live with this at this point in my life.
So you've heard Kirsten's story, and we're going to check in with her neck. And just looking at it, everything looks symmetrical, no swelling, no obvious spasm. So let's start looking at range of motion. Okay, we're going to turn your head to the right. That's as far as she goes. And we give it just a little bit of a slightest nudge to see how that end range feels. It's nice. It's not splinting or guarding. So her rotation is good. That's mostly C1 on C2. If we look at her occiput now, just slight extension and side bending. It's moving really well on both sides. So now we're going to look at side bending of the lower segments, just kind of gently moving her head back and forth and feeling for the spinous processes to move in relation to each other. So the disc issues were C6-7 and C5-6. So I'm mostly really concerned with how it's moving right there, and it's moving really well. If I give a little bit of downward pressure on your head, Kirsten, how does that feel in your neck?
Fine.
Fine. So it's just a couple of pounds of pressure, not very much at all. Okay, let's get a sense of how the nerves are doing on the right side. So I'm going to come around here. First, let's test strength. So give me a good squeeze. Grip strength, no problem. So I'm going to curl my fingers under yours, and I'm going to try and straighten, and you resist, okay? Good. No problem there. Wrist back now. Testing the wrist extensors. Nice and solid. That would be the one I would expect to be weak if there was nerve pressure on the side. And I'm doing the correct side, right? Okay. Now you're going to hold here. You're going to push. Good. Is any of that causing any pain in your neck? Okay. Pull the wrist up toward the shoulder like you're making a muscle. Good. Test the biceps, and now push the back of the wrist into my hand. Good. And then the arm straight out to the side. Yeah. I'm going to push down. Good. It's nice. Feels really good. So let's test neck muscle strength too. So we want to be gentle here and just have you tuck your chin, right? And when we're doing neck muscle testing, because the muscles are small and easy to overpower, we want the patient to give us a sense of how much energy they can produce. So just push your forehead into my hand, and I just match that resistance and then give like another pound, and she's able to hold. So that's good. Tilt your head back, push back against me. Same idea. Good. Come here. You're going to tilt down like this and turn this way just a little bit. So here we're testing the left scalene. So push the left side of your head. Good. And then this one is to test the right scalene. Push that right there. Any pain with any of that?
Nope.
Nope. It's all strong, super solid, pain-free. So it's really stable in there, which is great. So it feels like our job today is more of a maintenance care thing. Mm-hmm. And so how do we do that to a patient who has had prior trauma and severe acute pain in their neck? We do it carefully, we do it gently. We're not trying to make big changes. There's really no big changes to make anyway. She's doing really well. But we'll just start with you face down. Since it was the right side that was more affected when she was acute, we're going to start on the right side. But remembering that the disc is a disc, and the right side and the left side are not separate. They're totally attached. So we're going to work both sides for sure. This feels great. Kirsten was relating to me that she came back from her backpack and her massage therapist said, your muscle had never felt so smooth and pliable. And I'm going to echo that. This feels great. It's like, can feel easy movement as I'm gliding over your skin. There's really almost nothing creating resistance. There's almost no congestion. A little bit right there. And that feels really good. Let's test shoulder range of motion, okay? Holding the deltoid with my left hand, and I can really move her whole scapula here. I've got my left thumb on the front side of the latissimus, so I can feel how that's responding. Everything feels good so far. Feeling the AC joint right here, nicely mobile. I can get her arm into full abduction. Feels quite good. Rotation is really good too. So let's just pay a little attention right here where we're finding just the slightest bit of tightness. Feels like the rhomboid. Is that funny? Yeah. I'm going to lower this face cradle for you just a little bit, okay? Good. And let me know if this pressure feels off at any point. Good. So as that rhomboid comes up this way, attaching the medial border of the scapula to the cervical and thoracic spine, if I want to put some movement into it, it's pretty easy to just move that scapula up and in toward the cervical thoracic junction gently. We don't want to crowd her neck, but this just puts a little slack in the muscle and gives us a nice access to it. And then conversely, if I want to give it a little stretch, it's just a little traction on the shoulder with this hold. And coming from the thoracic spinous processes out to the medial border of the scapula. There's the trigger point, right there. Nice. Great. Let's look at your left side. Kind of surprised to find it a little tighter over here. Still feels pretty good. Feeling a little bit of that left-sided upper trapezius trigger point right there. We'll come back to that in a moment. Let's check the shoulder. Boy, look how nice and mobile that is. How old are you?
45.
Nice. Doing great. I've definitely found that the choices people make in their 40s reverberate all the way to their 70s and 80s. So
keep moving.
Yes, slow down a little bit, but don't stop moving for sure. I realized the other day that I'm 6 years older than my grandmother was when I was born.
Wow.
That's really weird.
Wow.
I know, because she was always really old.
Right?
Good. So just gently doing some fascial release on this left upper trap. Is that okay, Kirsten?
Yep.
Good. And it's feeling a little stuck here where it inserts on the scapular spine. And it feels like some fruitful tissue to work loose right there. Good. Good movement. Nice deep breath. And out. Good. When folks have lower cervical disc issues, you want to be really careful about P to A pressure on the thoracic spine because you can pretty easily hyperextend that cervical thoracic junction. So my pressure with Kirsten is not straight P to A, it's very much rotational. So I can feel the right side and its P to A movement by giving a gentle rotation to the spine, and then there's no P to A pressure endangering the cervical thoracic junction. It's important. Even if it doesn't cause them pain, it's going to set up a little bit of alarm in their body, and they're going to tighten up, and it's going to make your job a lot harder. So now the opposite is kind of using my right hand to bring a little bit of right rotation to the thorax, and so that left P to A movement is now evident under my left hand. And picking up on a little bit of stuckness in this section here, ribs 7, 8, 9. A couple deep breaths here. Good. Good. So let's work that iliocostalis muscle. Just like that. Deep breathing. And just try to gently get a little bit of mobilization in there. Good. Nice. Good. Whenever I work the neck, if it's possible, I want to start with the clavicles and work my way up. Because those pectoral muscles, those upper 2 or 3 intercostals, that subclavius, they all rule over the position of the shoulder girdle, which rules over the position of the neck. Because if your shoulder girdle is rolled forward, your neck is rolled forward. There's kind of no way around it. So here in the scalene triangle on the right side, that's the affected side. Always want to localize the neurovascular bundle first. Right there. It's a very slight prominence that you can see, and I just want to make sure not to press it. So I'm pretty well behind it here, giving a little stretch to the right upper trap and working its attachment on the clavicle here. Tiny bit rough and a little bit crunchy right there. Coming a little deeper, we've got the levator scapula, the posterior scalene, the middle scalene. And let's just really gently stretch those, okay? So just a couple pounds of pressure with my pinky, and I turn her head away. And we're gonna get a little bit of stretch on that scalene and levator. Feels good. Following that muscle up along its attachments on the transverse processes. Now we want to skip over the neurovascular bundle and check out the anterior scalene right here. So there's her SCM. There's the neurovascular bundle. There is her anterior scalene. I don't want to dig. This is a tender muscle. Just gentle stretch. Good. And a little bit of work on the SCM. When people develop trigger points in the sternocleidomastoid, it's usually right in here. This can be a big source of headaches, ringing in the ears, fullness in the ear, and all kinds of neck and jaw tension. So it's good to check in with that. And then as always, following that line, across the mastoid, up over the temporalis muscle, down to the jaw. The right side of her neck feels really nice. Open, smooth, taking really good care of yourself. It's good. Do you still drink bone broth?
No, not really.
Not so much.
I do collagen every day.
There you go. Good for you. Okay, let's check out the left side. Yeah, that's it. So lift your head just a minute. Good. Bingo. You see her sternocleidomastoid come up right there and come on down. That's not her anterior scalene. That's one of her hyoid muscles. The anterior scalene will be right here, which gives us our neurovascular sleeve right there. Middle, posterior, levator scapula, upper trap. So I had noticed a little more tension on the left side, so I am paying a little more attention here to make sure that we're not missing anything. Feeling a little bit of restriction where her clavicle meets her sternum right here. Just kind of gently stretch that tissue and get some traction through the clavicle. Really nice. Good. Kind of working in reverse order on this side. Anterior scalene first. That traction feel okay? Mm-hmm. Good. And the middle scalene, a little bit of tension here. If at any point you're feeling tingling in your hand on this side, let me know. Okay. Good. Good. Mm-hmm. Yep. So let's just gently stretch and open that scalene on the left side. The posterior middle scalene, very closely related, kind of hard to work separately from each other, but just a little space in there. Good. And that left SCM, checking for trigger points. Feels quite good. think this is going to be the easiest session I do all day. So good for us.
Great.
Yeah, I'm really glad you're doing well.
Yeah.
Yep, it's a good thing. Any more trips planned this season?
I leave Saturday.
Where are you going?
Finishing the last 75 miles in Washington. I was not able to get to because of a fire last year.
Wow, 75 miles.
Yeah.
On the Pacific Crest Trail.
Yeah.
I'm a little jealous.
It's going to be good.
That sounds pretty awesome.
Alpine Lakes Wilderness.
Oh my gosh. Well, I hope you have good weather.
Yeah, me too.
No smoke.
I know.
Yeah. Okay. Any questions?
The only question I have, my massage therapist wanted me to get looked at for Ehlers-Danlos.
Oh.
I don't know if that's something you do, but
No.
just based on your current knowledge of my body, is that something? What is your thought there?
Wow. Based on the way your tissues feel, I would not have thought about that.
Yeah.
Are you really quite mobile?
The stand test.
Yeah.
I definitely.
Because you can like be palms flat on the floor.
Yeah, no problem.
No problem.
Yeah.
It's worth getting checked for.
Yeah.
I don't think there's very much that can be done about it.
Right.
But it's good to know if you have it.
Yeah.
But I wouldn't have suspected it just based on what I know. Yeah.
Okay.
Okay.
Cool.
Anything else?
I don't. Oh. This little point right here.
Yeah.
Often causes like the pain is
Ooh,
here.
Yeah.
But I know if my massage therapist or even if I like stick a broom handle in my armpit, sounds horrible, but
Yes.
or she'll dig in there, right?
Yeah.
And it'll start to relieve it. But it's pretty like consistent.
Pain right here.
Like right on the top.
Here.
Yep. Which like there's nothing there.
It's just the distal end of your clavicle.
Yeah.
And it's relieved by pressure in your armpit.
Yeah.
So I've got my thumb up in there right now. This is interesting.
Like pretty deep.
Yeah, give me a minute.
Yeah. Sorry about that.
That's okay. I have to say, I don't know.
You're getting close.
I'm not even there yet.
No.
Way up in there.
Yeah.
Can you
There
come
we go.
see how deep we are in here? There's my thumb.
That's getting close. Yep. Right. Yeah.
That's it, huh?
That's it.
Can you rotate your arm? I lost it.
Yeah.
Oh,
That's it.
okay.
Mm-hmm.
Is that making your hand tingle?
No.
No?
No.
Okay,
It's
wow.
just really painful.
Can you push the wrist into my thumb here? No, the other way? Yeah, that's your subscapularis tendon. So I was doing resisted internal rotation. I could feel that tendon tighten right under my thumb.
Yeah.
So that's the subscapularis. And I have to say I do not know what is going on there.
Okay.
Okay. Sorry.
That's okay.
Bring a broom handle on the trail with you and you should be fine.
My trekking pole. I'll just use that.
Interesting. Thanks for sharing.
Yeah,
Okay.
absolutely.
Okay, thanks.
Yeah.
Yeah.